Hi, welcome to another episode of ASAP Conversations. And these conversations are a series that we have started because the communities that we work with often get left out and often do not get talked about much, especially in the mainstream media. And in the current pandemic situation where the entire country is under a lockdown, and there's not much we are hearing about the communities that we work with and the issues that they are facing, especially in relation to abortion services and the larger SRHR rights. And today's guest is Tejaswi, and I will pass it on to Tejaswi to give us a brief introduction, tell us who you are and what you do.
Yeah, thank you, Nandini. I'm Tejaswi. I'm working as Executive Director of Saheli Sangh, which is a sex workers collective in Pune, in my city. And I'm working in the field for last 24 years now, and involved in the entire process of formation of the sex workers collective. So, and the collective is the only sex workers collective in city. So we mainly have all need-based programs for sex workers, their rights, their health, including mental health, and SRHR obviously is an integral part of it, and many projects for the children of sex workers. So that's how we work, and working since 98. The organization is working since 1998.
Thank you so much, Tejaswi, for introducing yourself and for joining us for the conversation today, because I know how busy you've been in the last few days and sort of firefighting. So, but before we go into that, explore that situation, my first question to you is a bit about, what was the situation of the sex workers that you worked with before the pandemic hit? Like, and in general about sex workers in India, I'm sure, like, what does your experience tell us? Like, what was the
specifically regarding SRHR? If we need to talk, I think the main issue behind provision of all services and accessibility of all those services is mainly to do with the perception towards sex workers, the legal status of sex workers. Even though sex work is not crime in India, all the law and all the arrangements around sex work directly treats sex work, gets criminalized. So this is the situation. So when we speak about accessing any service, including SRHR and safe abortion especially, the perception and attitude towards sex workers is mostly very negative. People are not supportive, whether it is a private sector or a government sector. The list of documents one person needs to provide when the person is planning to go for abortion, I think that creates big issues with sex workers, because most of them, they are not the local women. They come from different parts of India, and so they don't have documents to support that they are staying here and they want to access all those services. And sex workers communities often get treated as, they just need services around HIV and AIDS and STIs, not beyond that. So once, if a sex worker gets pregnant, or if she wants to go for a safe abortion, that has always remained a question mark, that why a sex worker needs to get pregnant, and why, if she is going to get pregnant, then why she's going for abortion, So, all those things are totally connected with the stigma attached to their work, their profession, and the legal status.
You already mentioned there's a lot of migrant sex workers who come from other areas.
Yes.
And also,
Yes.
are they brothel based? Are they home based? What kind of work do they do? And also, in legal terms, how much what is their standing in the current situation in India?
Yeah, Saheli works mainly with the brothel-based sex workers, because the office is there, very much there in the red light area. And at present, there are around 2,000 sex workers. Since last 1.5 years, many sex workers have been displaced because of many crackdowns happening by police, and the demand for their all the documents and everything was going on. So they have been displaced, and usually we have around 4,000 sex workers in Pune's red light area. But now they have almost remained half of them. They are there, and others are shifted to different parts of the city, and that becomes very difficult to reach out to them and to support them to get access to various kinds of services, including health, definitely. So that's how we work in the red light area. Yeah.
So
So
it
mainly,
almost, please go on.
yeah, almost a brothel base, and few sex workers who stay in the outskirts of the area. They operate through brothels, either through brothels or to they go to different lodges and spaces like that.
Hmm, hmm,
It is
hmm,
not at all a home base kind of setting in Pune.
hmm, hmm. No, thank you for that, because I think a lot of our audiences might not be aware of the sex work situation in India, and it is in a very legally gray zone. It's a sort of,
Yes, it is. It is. Yeah,
so
yeah.
understanding that, and like we,
Brothel keeping is illegal, no? So
hmm,
even though there are brothels all over in India,
hmm,
and there are many red light areas, huge red light areas, still, the brothel keeper is often treated as the culprit, as the criminal, even though she is supportive. The perception towards sex worker is that she is a victim of trafficking. There is no space, no even thought given to the realities that many women enter into sex work voluntarily also.
hmm, hmm, hmm,
So the entire foundation of law is on these terms. Like entire sex work is trafficking, and so they are traffic victims. So anybody who is other than sex worker is a criminal.
right,
So that
right.
makes things very difficult. Yeah.
Right, right. No, so thank you so much, Tejasvi, for bringing that out, because we see that the kind of ways in which the sex worker community has been isolated. So that
Yeah.
brings me to my next question: that
Hmm.
what is the current situation, and how has the pandemic affected sex workers community?
Before the lockdown actually hit the society at large, brothels have been already, barricaded. The red light area was barricaded by the police, and actual lockdown started even before it starts into the city. Actually, so the red light areas have been closed even before the lockdown was announced, as if the women are going to spread corona to all the society. So the perception, you can it was so visible, and very senior sex workers, especially the founder members of Saheli, we got the same feeling, like what used to happen during HIV epidemic. The same attitude we can see right now also. And yeah, so that was the situation, and things are getting very difficult during the lockdown, and Pune being the red zone. Yes, since yesterday midnight, curfew has been declared. So it's going to be very tricky for the women to even live their normal kind of life. There are no earnings. Earnings have been stopped completely. Some relief work is definitely going on, but looking at the profession and the profession related things, it is very evident that women in sex work or people in sex work are going to need support at least for 6 to 8 months, maybe a year,
Mm,
even after the lockdown is going to get lifted,
right.
because to streamline their entire lives is going to take time. It's not very easy at all. So even though they are getting some support, it is just food.
Mm,
They need more than that.
mm,
They need to send money to their families, and their kids are with them right now. They usually stay in either the residential homes or to the daycare centers, but all the kids are very much in the red light areas. And like it is another responsibility for the women, and women are so afraid that if something happens, if corona patient uh, can get found out in the red light area, the things will be very difficult for them. They will always they might get treated as if they are spreading it, so that fear is very much there. And total loss of income is going to make things miserable for them, even to communicate with their family members back home. They need to charge their mobiles, they need to uh, have some communication, so it is also affecting their mental health, not just the survival, but the entire health, and including mental health. And lots of challenges regarding accessing ART. We face severe challenges in the initial stage of the lockdown, because ART medicines, they need to procure ART medicines going to the government hospital. uh, there was transportation available. There was a shortage of ART in the beginning, so it has taken some time to streamline everything. And so that was a challenge. Especially there were few women who were having they need third line ART. So for that they need to go to Mumbai. So to get those medicines from Mumbai to Pune has taken some days, and for a person who is living with HIV, ideally that person should not miss a single dose, but many women have missed their doses of ART. So that also puts them into tremendous risk. And access of very normal, very simple kind of medical needs, they have to go through all the police permission and that process, and there is nobody to accompany them, because police are allowing only that person to go. And Saheli doesn't have that much staff or the peer educators, even though because they are sex workers, peer educators are sex workers, so they are not allowed to go out, with the person to accompany her. So we face tremendous challenges, and we are still facing. And till these things going to improve, women are going to face challenges. Yeah.
So this brings in mind a couple of thoughts and a couple of questions. One thought is that sex work actually in India and globally, world over, has been seen, like at least in the modern history, that they are, that their physical well-being and even the fact that red light districts were first established was from the fear of sorting sex workers with STI and
Yeah.
bringing in new women and putting them in red light areas where the at that time maybe the British Army or the colonial
Yeah.
army could have access to
Yeah.
women. So, and even
Yes.
the HIV program, like I think that has been a big issue, that looking at the key population and like a sex worker as a community that needs to be quarantined to protect the
Yeah.
larger
Yeah.
community. And
Yes. It's called as
exactly,
a targeted intervention. No,
yes,
so you target that community and
yes,
try to control
yes,
the epidemic.
yes.
So yeah,
And I
that's
think
the
COVID-19 has also brought back a fear of stigmatization. Like,
exactly. Yes, a lot.
yeah.
A lot. We face a challenge in that context, especially when it comes to the PLH sex workers, because recently we had an incidence where uh, uh, one sex worker who is living with HIV, she was in need of abortion services, and uh, she need to go for a MTP. And so she tried to reach to the government hospital, where they actually registered her. They have suggested her to go for sonography, but then they started asking her that you need to have your husband with you, and all those kind of typical things started. And then she felt so disturbed because of that, and she ran away from that place and tried to go to the private clinics. At the COVID thing, the private practitioners are not doing any kind of surgeries, or they just told her, no, we can't handle your case right now. So again, the same thing happened, and then somehow our peer educator successfully managed to take her to the government hospital again, and after quite persuasion, successful MTP has taken place.
Mm-hmm.
So yeah, so all those things matter, transportation and permission and the fear, that's very much there. Right.
This whole the refusal, that is a very
Hmm.
common
Hmm.
thing that sex workers face even without the
Yes. Yes.
pandemic, and now because of
Yeah.
the pandemic probably even more, uh,
Yeah. Yeah.
denial of services.
That is.
Yeah.
Yes. Totally. Totally.
So this also brings to my mind, Tejasvi, that it's almost sounding that there are certain communities we had already socially distanced from, and
Yes.
now that we're
Yeah. Yeah.
using
That's true.
socially distancing as a terminology is very
Yeah.
popular.
Yeah. Yeah. And it is really very very painful to see, and to get through the experiences of even the organizations who are doing some kind of relief work in the remote areas. The entire attitude towards sex work is very different. A typical thing, like what they are saying that okay, we are providing them food and all those things right now, we will keep on providing them, but they need to come out of sex work one day, because if they continue with sex work, they will be at risk, they will put society at risk. So we need to think about provision of some rehabilitation measures to them sooner. So
Hmm.
that see, they are there to support, but
Hmm.
they come up with their own baggage and their own philosophies of a typical rehabilitation program.
Hmm.
And women are really afraid that if corona hits
Hmm.
sex workers, or
Hmm.
if it gets really very serious kind of thing for sex workers and the red light area, there is a possibility that some impact to the entire setting of red light area might happen.
Hmm. Hmm.
So that is the additional fear women are living with, because
Hmm.
the entire surrounding and the entire system will think in that manner, that okay, now this area should not exist here,
Hmm.
just quarantine them somewhere else. So what about their livelihood afterwards?
Hmm.
That is also a big fear women are having right.
Moving forward, like
Mm-hmm.
I just
Mm-hmm.
sort of want to understand, what do you think is the long term solution? Like, what is it that we can learn from this moment where, sex workers moving forward, can sort of live a more life of, freedom, life of more equitable and just life, like the rest of the population. So because something was definitely
Yeah.
not working before the pandemic hit us, and now the pandemic is making it more
Mm-hmm.
apparent. So
More
what
apparent,
is
yeah.
it we can demand? Who can we hold accountable to move towards a better and a more just world? A
Yeah,
little.
see, it is very necessary to decriminalize sex work.
Hmm.
We are not at all asking for legalization of sex work, but we are saying that decriminalization should happen. They are part and parcel of our community. They are women, they are men, they are transgenders, and they are definitely part of our society. And why this entire marginalization should happen? Just because the society consider them as with stigma,
Hmm.
and consider them as criminals, and the law is also doing the same thing by criminalization. So I think decriminalization is going to be a
Hmm.
answer.
Hmm.
It is going to be a big solution for so many issues of sex workers, because the entire philosophy of sex work getting treated as trafficking,
Hmm.
you need to see sex work as sex work, and trafficking is a issue, definitely a issue, but not only in context with sex work. There are so many other places where trafficking needs to get into proper attention. So this link should be understood very clearly, that entire sex work is not trafficking, and
Hmm.
it should not get criminalized. There
Hmm.
should be recognition of voluntary sex work.
Hmm.
Need to come out of your moral lenses, those glasses which people are wearing, including the policy makers, that entire sex work is treated with
Hmm.
immorality, this immoral. And you need to think, you need to see facts as facts. There are women, they have opted for this kind of livelihood option for themselves.
What Tejasvi just mentioned, this whole conflation of trafficking with sex work is a huge problem for sex workers worldwide. And it really, the parallel to it is how in countries like India, we often conflate abortion with sex selection. So I think, and ultimately who is paying the price is the individual that is choosing, for whatever the reasons that, there can be n number of reasons, but someone made that choice. And I think society and the state should really move towards respecting that individual's choice. And I think that goes for both sex work and abortion rights. And it's something that, to really think about. And I think, thank you, Tejasvi, so much. I
Thank
know
you.
there is so much to talk about when it comes to issues of sex workers and their access to SRHR and abortion, and it has been an uphill task, as you know from your experience. And it is heartbreaking because it's something that has gone on for decades and decades. But and
But the work should continue. That's the
the
that's the
work.
only, and we stay together. That's the only thing women can help each other.
Yes, yes. So, I mean, from our, I would just like to share solidarity from the entire ASAP team, from our partners, from our, people who follow us. Solidarity with you, with the work you do, and with the sex workers community. That we stand by them. And one last question to sort of end on a very positive
Mhm.
note, because you've been engaged in this, and you and I have been trying to fix this interview for days now, and I know you're busy with the relief
Yeah.
work. You have been
Yeah.
out in the ground and fighting it out. What keeps
Mm.
you going, and what would you like to share with others, that so that maybe they take leaves from your book, and like something to sort of keep us thinking that there is some hope somewhere and we need to keep going? What is it that makes you going?
I think women, their energy, their strength, the way everything is getting affected, but they are still staying together, supporting each other. I think it gives tremendous energy that you have that kind of connect with your colleagues and with your friends. And one major thing which I personally use all the time, like, you need to see facts. Don't go with your baggage. Don't go with the conception of, like, this is right, this is wrong. Just see facts as facts and work on it.
Mm.
I think that's it. That will definitely help anybody who is having a passion to and commitment to some work which the person has taken over. I think that's the only thing the person needs to do, and yeah, keep going.
Thank you. And in solidarity, we will all keep going because we have to win over the pandemic and
Yes.
hopefully build a better world. So, on
Yeah.
that positive note, thank you so much, Tejasvi. It was lovely
Thank
talking to
you.
you as usual.
Thank you.
And thank you to our audiences for tuning in.